Good afternoon, everyone. I'm Molly Enright, and I'm here to testify about my personal experience with the Colorado behavioral health system. So I've had many experiences with the system, and frankly, I could probably talk all day without repeating anything. But there's one story that I think can highlight a lot of the systemic problems that I've run into. So shortly after I turned 21, I attempted suicide. And I was suffering from depression as well as post-traumatic stress disorder due to a sexual assault that I had experienced a couple years prior. But unfortunately, I couldn't afford therapy or any medication. So my plan was basically to just keep going and hopefully my symptoms would go away, but obviously that didn't happen. After my attempt, I wasn't badly hurt, so I sought out non-emergency healthcare, but I had to wait almost a week in order to get an appointment. And when I was able to speak with the psychiatrist that I visited, she convinced me to go to the hospital and see if I should be admitted. And when I agreed that that was probably the best course of action, she then informed me that my choices to get to the hospital were either a prohibitively expensive ambulance ride or the police could come and take me. And so I chose the police, and they took me outside of the student health care center where I was and handcuffed me in front of all sorts of my fellow students, which luckily at the time I wasn't in a mind to really be embarrassed by, but in retrospect, not great. I waited 8 hours in the emergency room before I was able to see a single health professional. And after that, I was told that there wasn't a hospital bed available within a 30-mile radius, so I had to wait an additional 10 hours. So after the 3 days I was required to stay there, it took me 5.5 years to get a correct diagnosis and any sort of healthcare plan. And that was only after it had affected my life so much that I couldn't hold down a job and finally qualified for Medicaid. So, like I said, I've had a lot of experiences that also highlight the inability to afford care, long wait times for treatment, and the need for emergency care in lieu of preventative care. But I consider myself extremely lucky with my experience because I've met so many people that can't even access reliable mental health care resources at all. They never receive any form of treatment. Their primary hospital is hundreds of miles from their home and their support system. And if I ran into any of those barriers of treatment, I'm not sure that I would be here today to tell this story. Yes, thank you all very much for your time.
Thank you, Molly.
Thank you.
Thank you.